pay extra for this.
Okay, so today we're going to test for cranial nerves on Mr. Bushinski. So, hi, I'm Susan. I'm going to be your nurse today. I'm going to do some cranial nerve testing with you. And so the very first cranial nerve we never test for, that's olfactory nerve, and that is the sense of smell. Usually the neurologist will test for that in their office, but normally people don't carry around like coffee or vanilla kind of scents with them in order to test cranial nerve 1. So when you see doctor's notes or provider notes, they usually say cranial nerves 2 through 12 are intact, and that means they've only tested 2 through 12. So number 2, cranial nerve, we're going to test for visual acuity. So I've asked you to practice using a Snellen chart, but for the purpose of your video, you're going to describe how you would test for the Snellen for visual acuity. So the Snellen chart is a chart that's on the wall. It's placed 20 feet or 20 steps kind of away from the patient. You would ask your patient, does he wear glasses or contact lenses? And if he says yes, or she says yes, you would have them use their glasses or contact lenses. In an ER or urgent care setting, often people forget to grab their glasses when they go, and so you may have to test without using glasses or contact lenses, and you would just make a note that they didn't have those with them, and that would explain the somewhat poorer results that you would expect to see with visual acuity testing. So I have the patients at 20 feet away from the wall chart, and I'm going to test their right eye, then their left eye, and then both eyes. And so the way that I'm going to do this is I'm going to have Mr. Bushinski cover his right eye. I would have him look at my chart, and I would have him read the lowest line possible that he could read. And it should be around the 20/20, which is considered to be normal vision for an adult. And if he couldn't read 20/20, I would ask him to read the line above the line that he could closest read without missing more than 3 of the characters in that line. If they miss 3 characters, then they failed that line, and you record the line lower as their ability to see. And so then I would have him test his left eye doing the same way, covering his left eye, and I would ask him to read the lowest possible line on the chart that he would read, and he would read it for me, and as long as he didn't miss 3 characters, he would pass that line, and I would record that as his vision for his left eye. And again, it's recorded in a fractionated number, either like 20/20, 20/30, 20, and he might even have better than normal vision. It may be 20/15, and that's possible with a normal healthy person, and so you might put 20/15. And then finally, you would have them uncover both eyes and read the line lowest on the chart that they can read, and again, not missing more than 3 characters. Otherwise, you have to move to the line above that in order to have them read that. So with that said, that is visual acuity testing. So the next thing is we're going to test, and that was for the optic nerve. So cranial nerve 3 is actually the oculomotor nerve. It is a mixed nerve, meaning it tests both motor and sensory. So for cranial nerve 3, you're going to test for extraocular movements. Now your book, I'm not sure which pattern they have, but you can technically do this using 2 patterns. You can use a star-shaped pattern, or you can do a H-shaped pattern. Either one is correct and acceptable. I'm going to do the starburst pattern for demonstration. So I would position my finger approximately 8 centimeters away from Mr. Bushinski's eyes. I would say, can you please follow my finger without moving your head? And I would have him follow my finger in a star-shaped manner. And while he's doing this, I'm looking at his pupils, and I'm looking for extraocular movements, also known as nystagmus. And this is what the police, I know I keep referring to at the side of the road, but this is one of the tests that they test for driving while being impaired. Because people that are under substance abuse or use will have deviations, and they may have extra beats as they move their eyes across the visual fields. Mr. Bushinski didn't have any nystagmus or any extraocular movements when I tested in a starburst pattern. So I would say his EOMs are intact. And the next thing I would do is I would have him stare straight ahead, and I would test for direct and indirect pupillary response. If you remember this from when we did the full assessment, the way you do this is you come with your pen light in from the side, and you can dim the lights, and I look for constriction of the pupil on the left side and then the right side, and that is direct pupillary response testing. And he has brisk constriction of both eyes. His eyes are about 2 to 3 millimeters in size, his pupils. Then I would put my hand directly in the middle of his nose, and I would shine my light on the left eye. Eyes are supposed to work together, so as I shine my light and his left eye constricts, I look over to the right side, and his right eye should be the same shape, size, and have the same constrictive type of movement to it. They shouldn't work independently. And then I would do the same with the right side, looking at the left side this time, and that is indirect pupillary response testing. And so he has normal response, and so that is intact. So the next thing I would do is I would check for perla. Perla is when we just, like we did the first time, come in for the side and you look for both eyes. And I would say that his pupils are round. They're not any oval shaped or any abnormal shape. They're equal in size. They're both about 3 millimeters. They're reactive to light. And the very last part of perla is accommodation, where you would come about 8 centimeters from this and ask them to follow the pen light or your finger directly inwards, and you should see downward inward movement. And the accommodation is actually cranial nerve 4, and that is downward inward movement in the eye, but it is also the A of perla. The next thing we're going to test is cranial nerve 5. Cranial nerve 5 is the trigeminal nerve, and this is a mixed nerve as well. This tests both motor and sensory. So the motor testing is strength against resistance. So I would say, Mr. Bushinski, I want you to close your mouth and try to open it against my hands, and then I would have you move your head, and you're testing the muscles of the facial nerves, and he has full resistance of both areas. You can also have them close their eyes and try to open against resistance, and hopefully they wouldn't open. He has no idea what I'm asking him to do, so it's kind of hard for him to follow. But with your patient, you would explain that you're going to have them close their eyes and try to open their eyes, but you're going to try to keep them shut, and that's the resistance part of it. So the next thing you're going to do is you're not going to test, but the sensory portion of this nerve would be sensation of the face, the scalp, and the cornea. And again, you could take a cotton ball and you could have them close their eyes and have them identify where you're touching with the cotton ball on their face. The other part of this is the condition and the sensation of the mucous membranes. And you can actually take and twirl the end of the cotton ball and touch their cornea and try to have tearing happen, and we're not going to do that. So with this, I would say that cranial nerve 5 is intact. Cranial nerve 6 is lateral movement of the eyes, and we already tested this when we did the starburst extraocular movement. He did side-to-side movement, and he was able to do lateral movement of his eyes, and so therefore that was intact. The next is cranial nerve 8, and this is muscles of mastication or chewing. Can you make a chewing movement with your, very good. And then the other thing is that ask him to say a 2-syllabus word like baseball.
Baseball.
And we're looking for movement of the upper and lower lips together, and that is called labial speech. The next thing, you can also have them like pronounce their name, a 2-syllable word. You would have them close their mouth, ask them to smile, ask them to frown, ask them to raise their eyebrows. You want to ask them to puff their cheeks out with air. And that's testing for cranial nerve 7, and this is cranial nerve 7 is the facial as well. You can also test, and we're not going to for this purpose, taste and have them do salty, sour, and sweet testing to see that the sensory part of this cranial nerve is intact. We're not going to do that today. And then the other part that we wouldn't do today is elicit tears by touching his cornea with a cotton ball and stroking it and producing tears. Saliva is the next thing. You could give them something really sour, like a sour candy or a piece of lemon, and see that the saliva is produced in the mouth. And we're not going to test that today either. So with that said, cranial nerve 7 is intact, and that again is the facial nerve. The next cranial nerve we're going to test for is cranial nerve 8. And that is hearing, or the auditory nerve. And the way we're going to do this is we're going to do a whisper test. So to do a whisper test, you would take your fingertip, plug this ear, and you would do a 2-syllable word and whisper it. Baseball. And have them say what word it was.
Baseball.
And then you would go and you would repeat it on the other side.
Baseball.
And have them repeat it. And you're testing their hearing, so their hearing is intact. And the next thing is equilibrium. We're not going to test that today, but we did that with the full assessment with the gait testing, and that tested for equilibrium. We tested for station, their ability to stand up straight and not basically fall over, and that is station testing. So cranial nerve 8 is intact. Cranial nerve 8 was the acoustic nerve. The next is cranial nerve 9. Have them say ah. And the next thing, you would take a tongue blade, you can take a gloved finger, and you could stick it towards the back of their throat and form a gag reflex on them. That's part of this cranial nerve. I'm not going to do that today with him. So if the gag reflex is present, if they're able to say ah, and their uvula in the back of their throat rises midline without any deviation side to side, then this cranial nerve is intact, and this cranial nerve is 9, and this is the glossopharyngeal nerve. And next, we're going to have cranial nerve 10 and have them state their name.
David.
Can you state your date of birth?
6/3/55.
Okay. And then with his verbalization, I notice he has no hoarseness. His speech is clear. I would have him swallow. And I could palpate him swallowing. And so with this, I would say this cranial nerve 10 is intact. Cranial nerve 10 is the vagus nerve. So the next cranial nerve we're going to do is 11. And we're going to we've already done this on the full assessment, but have them push against resistance, side to side. And then back here, and cranial, that motor testing is intact, and they're able to push against resistance. We've already done the shoulder shrug of the trapezius against resistance, and so doing those two things, we can say that cranial nerve 11 is intact. And then finally, cranial nerve 12, have him stick his tongue out. You want it midline, you don't want it to deviate to one side or the other side, and have them move their tongue in a side-to-side motion, and that's intact. So cranial nerve 12 is intact as well without any deviations, and that is testing of the cranial nerves.